mutant prolactin receptor and familial hyperprolactinemia.
The pituitary gland, protected deep within the middle of the head, is often referred to as the master gland of the body, since it regulates many activities of other endocrine glands. Let's take a closer look at an enlarged view. Located above the pituitary gland is the hypothalamus. The hypothalamus decides which hormones the pituitary should release by sending it either hormonal or electrical messages. If the hypothalamus released the growth hormone-releasing hormone, or GHRH, the pituitary would release growth hormone that would affect the body tissue.
Definition. Prolactin is a hormone that is secreted predominantly by lactotrophs in the anterior pituitary gland. It is required for the induction and maintenance of lactation in the peripartum and postpartum periods. Hyperprolactinemia that is not associated with gestation or the puerperium is usually due to tumors in the anterior pituitary gland and occurs occasionally in hereditary multiple endocrine neoplasia syndromes.
Recently diagnosed with high prolactin levels, and this condition is known as hyperprolactinemia. There's a lot of different things that can cause it, and one of the first symptoms a woman usually has is she's not having periods or not having regular periods, and it sounds like this is the case with you as you've been trying to have a third child, and you didn't have a problem with your first two. Many women don't have periods, they go seeking help, and this is sometimes a diagnosis that's found. High prolactin levels affect your ability to ovulate, and that's why it's hard to get pregnant. Certain medications can cause higher prolactin levels, and there are other explanations as well, and it can go along with other hormone imbalances.
Hyperprolactinemia unrelated to pregnancy occurs in approximately 1.1 to 1.3 of the general population. 2.3 and may result in infertility, hypogonadism, and galactorrhea. Such non-psychological hyperprolactinemia is caused mainly by drugs or by tumors in the anterior pituitary gland, which are usually identifiable by means of magnetic resonance imaging.
Hello, I'm John Atkinson, one of the neurosurgeons here at the Mayo Clinic. This is one of the largest neurosurgical divisions in the world, and interestingly, one of the largest pituitary divisions of neurosurgery in the world. What makes the Mayo Clinic unique with pituitary diagnosis and treatment is a multi-specialty approach. That is, we have superb neuroradiology to help us visualize the tumor, but also a superb endocrine department to help us diagnose the tumor, realizing that perhaps
Familial idiopathic hyperprolactinemia may be due to either abnormalities of the prolactin gene with the secretion of biologically inactive forms of prolactin, or to prolactin insensitivity, caused by a mutation of the prolactin receptor gene. Conclusion. PRLR mutation, prolactin mutation, which results in a loss of function, is a cause of familial idiopathic hyperprolactinemia, a condition that is associated with oligomenorrhea and infertility, and the related disease.
The most common pituitary disease is indeed pituitary tumors. And it turns out that about 1 in 10 people in the population have a small pituitary tumor. And these are called incidentallomas because usually they're found by accident. So somebody comes in and needs a head scan because they're having a headache, or maybe they had a motor vehicle accident, and you find a tiny tumor in the pituitary. Most of these tumors are clinically insignificant. They do not produce hormone, nor do they knock out hormone production. The tumors that we worry about in the pituitary gland are tumors that actually overproduce hormone.